Great. So obviously this is our Board of Health meeting, June 16th. Thank you all for being here. And basically I just want to kind of, for this meeting, so the first thing on the agenda is to report out of from me. And so I just thought what would be great is just kind of give you an inkling of where we're at, what I'm thinking, and not necessarily like a decision point today by any means, but just kind of starting again from the basics. So probably haven't seen this in a while, but our vision is to empower our Lake County community in making healthy choices where we live, learn, work, and play. And the mission is promoting healthy choices, preventing disease, and protecting our community through ongoing assessment, education, and resource sharing while engaging in a holistic approach. And so the 3 Ps are there for public health, which is promoting, protecting, and preventing. So when we had devised this mission statement quite a few years ago, there's opportunity to revise it. I think I'll be looking at that in the next year when we actually have the opportunity to do some strategic planning to say, does that still fit? Is there ways to change it and or reflect more of the county and kind of blend, so to speak? And so that is kind of what we have and where we're at. So the next thing, I just wanted to show you what our current organizational chart looks like. And so this is kind of everyone. There is a person in each of these positions currently, except the environmental health director. But I had created this a little bit before Jackie had left. And so as you can see, we have, the medical officer, we have the Board of Health, obviously the BOCC above that, and Tim part of that chain coming down. But because the BOCC and the Board of Health is one and the same, I just tried to kind of capture that piece. And then we have an EPR coordinator that works with all of our team. We have our support staff, we have our nursing team, we have our environmental health team at this point in time. We have our aging well coordinator and we have our COVID team. Plus we also have goal. So I kind of did that little dotted line versus a solid just because while goal sits under the public health umbrella, they are pretty independent at this point in time. A lot of it's just kind of a check-in with the director, as well as just ensuring if there's anything that I can assist with and just help with some of the management pieces and going from there. And obviously that's a whole separate chart. And then this is something that I am thinking about for the future. So I thought I'd just drop it in there and show you guys now. Is one of the obvious pieces to me is goal is no longer under public health. So if there's that opportunity to either come out from under us, be their own department, work in conjunction with, rec or whatever that bigger picture is down the road. Like I said, don't want any decisions or a big conversation on it, but by, taking out that large chunk out from under public health, it kind of helps my team, especially as we're, working through COVID and feel like we've got a good handle, even if we surge, and how it just will continue to fluctuate through the season, so to speak. There's opportunity to kind of expand some of the services that we're doing. And so the positions in gray are currently not filled. That's not to say that some of that work cannot be taken on from some of my current staff, like some of my nursing staff specifically. I just wanted to capture that there are some pieces that we just don't have the opportunity right now to build out something robust. Is there opportunity to think about what we want? And I think part of the Board of Health is really trying to help, myself and drive like what we think is important, what program we want to see happen, and then trying to figure out how we make that happen, so to speak. So some of the gray areas too that I have is I really do have that vision in the future of a deputy director as well as an EH manager. Part of the conversation we had prior to Jackie leaving was, once she got her team stable. So we're very fortunate. If you look under the environmental health team currently, we have 3 positions. And at one point in time, Jackie was doing all 3 positions, right? And so we've been very slowly able to, bring folks on board, recognizing the need to have, more folks doing this work with the opportunity to cross-train people then in, those programs. But instead of bringing on like environmental health manager, that might be the starting point. And then depending on their skill set and their expertise, then building them up to kind of come into a deputy director role where they're still managing the environmental health team, but also then allowing me to kind of divvy out some more time, work on some of these other like community outreach pieces, as well as just that day-to-day. Yes, there's a hand from Lake County government.
Hey, sorry, Colleen.
No, it's all good. That's what I say. Jump in, please. This is totally like our Board of Health. It's not
Sure.
like, it's pretty informal.
Yeah, just can you make your screen just a little larger for us?
Oh yeah, sorry. I don't know why it's, it should be doing the full, but it's giving me the next slide, which I'm sure you guys can see that as well. I'm guessing, right?
Corner, but it makes the other slide smaller. And so I was just wondering if you could.
Oh, sorry, I went the wrong way.
Talk through who's currently in these positions and roles right now, like.
Yeah, absolutely. What I'll do is I'll bring it up as its own thing. So just give me a second to pull up that chart so we can see a little bit better. I think that would be much easier than on a slide. So give me 1 second while I bring that up.
Awesome, thank you.
Yeah, no, absolutely. I think that's like, I want to be able to blow it up, and the only way I'll really be able to do it is to do it this way. So give me 1 sec and I'll bring up my future chart. Do you want to see the future? Because then the future has everyone on there. So
sure, that's fine.
Yep.
I think whatever's easiest, and then if you can just talk through who's in those current slots, that'd be really helpful for us.
Absolutely. There we go. And then I can make it a little bit bigger.
Yeah, that's great.
Okay. And then I'll kind of, oops, sorry. I'll work my way through. I've got to kick you guys out so I don't see you. But so basically right now, right, we know who Board of Health is. We know our medical officer, which you guys did appoint in January. And that is also on our agenda, just to sign that form. We need that additional form for family planning specific, to recognize that these are the pieces that have to happen in family planning. And so hence why that is on our agenda, to just have that signed so we have it on record, even though the state knows that the Board of County Commissioners has appointed the medical officer, and you also act as the Board of Health in that role. And so obviously you know who I am. Oh, I'm wondering why. Okay, it doesn't matter. EPR coordinator currently, as you know, is Mike McCarg. Obviously we don't have a deputy director / EH manager. I might have made the change on the slide and not on here, but that's kind of where my brain goes. For support staff, we have our office manager, chief deputy registrar, which is Nadine. She also has been helping with some of the COVID work, some of the translation. She's also does translation and interpretation for us. Our finance and grants management is Julie, and our communications currently is Sean. The position that is open, that I do believe that if I could bring someone in, and I just had this conversation with Ali, just so you know, we did just interview some folks for the EH admin position, and the one person that we would think might actually fill this role, I do have a grant for that, with the intent to start them reception, increase their awareness with vital statistics. So right now, Nadine is the only one in our department who can issue birth and death certificates. When it comes to death certificates, that is a very quick turnaround. Like, we don't have much play. And, or if there's what they call a drop to paper, the funeral home's like, hey, we need to move, we want to move forward with, a funeral, like we have to get them the information for that right away. There's no waiting on that. And so that's really hard. So even when Nadine's on vacation on some of these, like, she's not. And so we'd love to get somebody else trained in to administer all those things. And so that's where we're at. And then in turn, train that person into our environmental admin assistant. As you guys may or may not be aware, Kim had given notice, Kim Jackson, but had decided, she just came back from vacation and kind of pivoted and shifted to a whole different way of how she wants to do her next year. And so and hence we had to re-interview this morning. So we re-interviewed her along with this other person, had the conversation with Ali, thinking that we will probably look to bring that person in as that kind of gray box right there in reception and vital statistics. Okay. And then I apologize, if you raise your hand, you just have to let me know, because I kind of shut down all the other windows. Just jump in and I'll be ready to answer. And so with our nurses team, our blood-led maternal child health is Heidi Hull in that position. And in that maternal child health, that's where we're capturing breastfeeding and all the work that's happening there, which has been really exciting. We have a really robust coalition doing a lot of work, especially around events, working with community partners, allowing space for breastfeeding and when we have large events on the avenue. And so that's been really exciting. Immunization is Julia Johannesson. And in family planning is Fran Jimenez. And then our environmental health team, currently it's Kim Jackson. And then for retail food in our school and childcare licensing, that is Kelsey Maxey. And for our on-site wastewater treatment systems, that is David Wilson. When we move over to Aging Well Coordinator, that is Judy Main. Our senior center assistant, cook, clean, and drive, is Loretta Barella. For our senior center assistant who does driving, that is Bob Vihill. For our COVID team, we have Heidi Coates is the COVID nurse. For contact tracing case investigation, we have Jenny. Oh my gosh, I just lost Jenny Brown. I was like, I just lost her name. And then we also have contact tracing case investigation. We have Isela. No, not Isela. Oh my goodness, Sarita Castillo. Sorry, getting old names with new names. And so that's who we currently have. And I must have made, because I can look at my, I must have made some adjustments on the slide. So what we are doing, so for tobacco and oral health, we are actually pivoting Jennifer Brown into that role. And so then that will leave Heidi Coates and Sarita. Sarita is currently out on family leave. And so she should be back with us in July. And we'll go from there. That is, so that's all the folks. And then obviously, Get Outdoors Leadville, that team as well. And, obviously Vanessa Salazar being the director, and then there's Tim Best, Mary Palumbo, Jackie Radia, Natalia, I'm losing her last name right now. And then the other piece that I will share that COVID, Heidi Coates has the ability, because she's trained into childcare, she's also going to act as the camp nurse for the month that they need that. So she's doing that work for Get Outdoors Leadville as well. So that is everybody.
You guys have any questions for Colleen on that currently? How it sits?
I guess one question is like, so each of these green boxes is like, are those all full-time FTEs, full-time positions?
Mm-hmm.
The only one that's not full-time is our COVID RN. She is part-time. And the senior center assistant, so Loretta is part-time, because the other part-time for her is through the COG. And then for Bob, the other one, it truly is part-time as well. He does medical appointments and then brings people into the senior center for meals and that kind of thing. And that's not full-time either.
Okay.
Yeah, and if there's a better way, like I said, this is just like putting it all to paper. And if there's a better way, or if you want like, hey, can you add this detail? More than happy to put 0.5, 1, FT, whatever makes sense to you guys. So. And I think, when I look at some of the future work, like community outreach, we just kind of dabble when there's opportunity. But like I said, Jenny is going to start doing tobacco with the intent to then expand to oral health, because they kind of go hand in hand in so many different ways. And then, oh my goodness, Janine and I are talking about a health navigator, what that might look like for the county, just trying to figure that out, knowing that the hospital isn't necessarily fulfilling that role, but also strengthening our ties with our community, Connect for Health community. We do have somebody come up from Chafee. We also work with the FERC down in Summit, but just trying to figure out if there's like another place that we get somebody locally doing some of that work. Opioid work, it's just being captured to try to figure it out. I think some of the gaps that I'm seeing is that we don't really have a point or a lead on kind of what needs to happen, and trying to figure out, that'll probably fall to me initially of, hey, I'm working with our community partners and trying to figure out like, hey, is it language that we want to start with? Because, as some of you might know, we have outlined Lake County, as well as some of the bigger stuff that's happening on the regional. I think suicide prevention is something that we don't do a lot of. Like I said, we touch on it, but it's not something that's super robust. We do get funding for child fatality prevention. I don't think there may not be an understanding that when there is a child fatality, so anyone under 18 that is suspect or possibly preventable, I actually have to put a team together that includes our like public health, law enforcement, human services, probation sometimes steps in, coroner, to kind of have some of these conversations of, hey, are there anything that we're missing preventive wise that we can put in place? And so, knock on wood, we've been very fortunate the last couple of years not to have that. Our last case that we had to do, unfortunately, was a child that died in a fire, and just trying to figure out, where that prevention piece was. But I do think there's a lot of opportunity to work around suicide prevention, to actually dedicate the time and, staffing. Like I said, some of this work can slide into some of my nurses, but just I'm just putting it out there. And that includes, diabetes, then moving down the continuum, like diabetes and heart healthy. There are a lot of really simple programs that my nursing staff, can get trained into. Heart healthy happens to be one of them, versus like a full-blown diabetes educator, which is a huge undertaking, which I'm not opposed to in the future, but that'll just take time to do that. But I think, just trying to make some of those pieces a little bit more robust, and really thinking about that prevention piece, because you can see so much of what we do is that direct service, almost like filling in the gap for medical services that folks aren't, receiving locally, and or there's a barrier to get them locally. As you know, that we don't refuse service for lack of payment. You don't need insurance. When we have the opportunity to bill, we do bill. But I think that's me kind of looking more upstream of like, what does that community piece look like in some of those preventive pieces. Granted, when we're doing immunizations, that's preventing, vaccine preventable diseases, but I do think there's opportunity for more. So any questions on that? But I think I need, like I said, I do need some assistance. Like I can't just take this on. And then, as you can see, when I think of like span of control and how many, folks that I have teams, versus individual, because if it was just individual, I'd be way overwhelmed. So we basically work very intentionally as teams, meeting with everyone, like as a team. I do some individual one-on-one as well, especially for our newer staff, but it's a lot, as you can imagine, plus goal on top of that. So just pointing that out.
I had one question, and
yeah, of course.
I don't know how far in we want to go in this session, or it should be like a separate work session, but I mean, just on some of that community outreach ideas, I think like the health navigator and some of like maybe suicide prevention. I just feel like I don't know, for me, I'd like to understand better what other like what is the hospital doing, because at least the hospital has a person showing up to community coffee who's like a patient advocate navigator.
They don't currently. That person left their position and they haven't filled it. From my understanding, that might have changed in the last week or two.
There's a person who I saw last night at the town hall who seems.
Oh, did they hire someone else in?
Yeah.
Okay, cool. I didn't get that information.
So bad at remembering people's names, but she's a delightful person. So I mean, just to understand what their, plan is, and then also like around like the Justice Center planning, there's like a navigator position there. It's not like health navigator, but it is someone who's supposed to like be connecting people to like substance abuse, mental health counseling.
No, it's just fantastic. And so like I don't know that we necessarily need like 6 health navigators, but if there's opportunities to support that and actually have it, not be siloed in a way, because I think sometimes that's kind of how that happens. Like I don't know that there's like a big overspill of the work that's happening at the hospital to really point to all these other resources. But no, that's exciting. And then not to say there's opportunity for funding that I can help support that. I'm all in. Like we do not like have to take that on if somebody's taking it on. It's just been a gap. And when we put health in there, it's not case management being like, oh, I'm going to call your doctor and make sure your doctors are talking. It's truly, do you know that this is what you can do next? Like, do you know that this is an opportunity? Hey, you can go to the Summit Community Care Clinic if you don't have, insurance, kind of a thing, to get more of those direct services that we don't provide. And so I think for Health Navigator, like I said, this is just like pie in the sky, put it out there. And that's the beauty of the Board of Health, is really like having an opportunity to shape that and what we think truly is the need. So this is not me saying like, this is absolute. This is just me putting it on paper to say, what do you think? And what do you think that means? And what do you think we need? Utilizing our data and our, community health assessment and things like that. So. Yeah, not as a competition of anything, more collaboration. And like I said, if someone else is doing it, that's great. Just need that access point, that everyone has access to that one point, versus, hey, there's a health navigator. They're only able, because they have so much work, they're only able to serve, the Justice Center and the folks that are utilizing those services. well, then what does that look like? What have we learned? And do we need to build on that, with Health and Human Services, like, so public health and human services, like, do we have to fill a gap, so to speak?
Yeah, no, I mean, I'm sure there's some gap there because, I mean, the navigator position that's currently piloted here in this courthouse, and I mean, we're still 2 years away from having the new courthouse, but like, it's targeted towards people who are getting enmeshed in the legal,
Yeah, in
law
multiple
enforcement and
systems,
courts.
Yeah.
So it's not like, I don't think that'll be like tobacco health. It's gonna be, like, go down the hall to probation, don't walk out of this building until you make your appointment.
Right. It's a little bit different, right? So, and I'd also be interested, I don't know where we're at with the, is it CU cooperative person?
The CSU extension.
Thank you. Yes.
Yeah.
I was like, I don't know what opportunities might be there of them just to know resources. And at Full Circle, they do have somebody who's working on those resource pieces as well. So I think, there's opportunity in the future to really form what do we really think is needed, who should own it. Like right now, I just dropped it in for me or public health, not me. Sorry.
Yeah. And then, sorry, another question.
Yeah, no, that's why we're here. This is awesome.
Is on the COVID team, like what are people thinking? I'm not advocating for this. I'm just curious, like from a state or federal funding perspective or health need, is that gonna go away or reduce at some point? Like, and sorry, I don't mean this in a snarky way, but like, I mean, are we really still contact tracing? It just feels like everyone's stopped paying attention.
Everyone's doing their own thing.
Yeah.
No, so the reason we still have full staffing on contact tracing is that we are responsible for outbreaks, and that's when it is truly the full meal deal of contacting everyone, including acquaintances in an outbreak situation. The only true setting that we have that's designated from the state that might fall under that outbreak situation is the school district. So we've been keeping people in place through the end of the school year.
Okay.
And then our COVID RN is also starting to do some infectious disease. So basically learning different things like tuberculosis and, even flu and some of the other pieces that we kind of deal with, like giardia, like things that we have to do investigations on. So I'm able with that COVID funding to utilize that person to learn some more of these infectious disease pieces, because we do have to do investigations. Like I have a whole list of things that we're responsible for investigating. And so that's kind of where we're at with that COVID RN, who will also do infectious disease. And I feel confident that I'm funding them through, 2024 if I need to. Obviously, we're able to pivot and shift. I'm still kind of waiting for the state to see where they're at. And the other contact tracer is going into tobacco work full time. So that person's coming out, and we'll have a bigger discussion when our person who's on family leave comes back in July to see is there a way to utilize their skill set in a possible different manner and not knowing what that looks like now. So I am looking to reduce and cut down on that overall, and also cross training. So Nadine Castillo also has the ability to do contact tracing. She's done the trainings, and she helps, with the Spanish speaking folks to make sure that we're getting our message across and answering any questions. But there's still, as you can imagine, it's almost like it's almost going back to the basics of until you're impacted with COVID, no one still really cares. But I can't tell you how many phone calls we continue to field of like, I just tested positive. What do I do? Kind of a thing. So I still like to have that ability to have some of, someone, especially now as a COVID RN, like answering that from the medical perspective as well as social. So right now, when we do get folks, it's more of a courtesy call, unless it's related to an outbreak. Like, hey, do you have any questions? You tested positive. And a lot of folks like, no, I got it, but other folks don't. So right now it's a very quick kind of courtesy call piece, not a full blown, I'm going to ask you 100 questions. It's more of a courtesy, make sure they know, do they need any resources and that kind of thing.
Okay.
Yeah.
Sarah, I think Sarah's got a couple questions, and then I'll go after
Yeah,
her.
yeah, absolutely. I'm gonna start writing down just to make sure I'm capturing some pieces. I will just share that, like, I don't want to spend a ton of time on like future today because I still just want to talk about the basics. So that's like an opportunity. Like my point is I don't want a ton of decisions, but So I just preface it that way. Like, I don't want to go down a rabbit hole of like, hey, we really want to talk about X, like opioid work. And I'd be like, I actually don't have any answers on that yet. So I'll just preface it that way. Shoot,
No,
sorry.
yeah, go ahead.
So, you said that you mentioned the team and like the structure and the kind of coordination between the teams, and what I heard was like, you know, everybody under your blue leaders, they all meet together. Is there, do those then, the nurse team, the environmental health, aging well, and support staff, are there times when those folks connect?
Yeah, absolutely. So there's so much overlap, as you can imagine. Like, so we have people who are physically here. Obviously in my office, Aging Well's not here and Goal's not here. But so basically I have a weekly nurses team, a weekly environmental health team. I meet with support staff pretty regularly. And then we do bi-weekly staff meetings where everyone's coming together. So the COVID teams, you know, in on that, because we have the ability to do the, you know, hybrid calls. So we have some folks physically here, some folks on Zoom. And so everyone is connected and linked. And, you know, as you can imagine, there's a lot of referrals that kind of work their way back and forth across the team, so that everyone understands like, oh, I have this question, you know what, I need to, you know, direct this to Judy, or, oh, I have this question, I need to direct this, you know, to Heidi. So there is that opportunity for that.
Okay. Yeah, and I guess I'm wondering kind of like to the health navigator, maybe some of Jeff's comments or questions, and like an overarching thought on like not, you know, sorry, not necessarily doing new things, but getting a good, like, I think there are some gaps of like where then those team leaders participate in regional areas like COG or like the workforce, or I would love to see, and maybe it's happening and I just don't understand that, but I would love to see maybe some greater coordination with like Department of Human Services and probation and seniors, and like even C4, like we chatted about with one of our last work sessions. Judy was here with you, and like figuring out how to even assess what the gaps are and needs are in the aging community of Lake County, and really like figuring out with those folks in their existing positions, and maybe I can relate this to like taking that idea of that health navigator and like just splitting kind of that responsibility up into the existing positions of like really making sure that everybody understands resources in the community instead of just developing maybe a new place to get those resources only in public health. And I don't necessarily think that's exactly what you said, but I would just love to understand better, like even like family planning, I would love to understand how, you know, that's continuing and how much that person might overlap or understand with like workforce development and the school district and teen pregnancies or youth, you know, health. And so I don't understand that a lot of that kind of relationship building or stakeholder like communication is going on, and I would love to encourage that if it's not.
Yeah, absolutely. I think, like I said, I don't want to like take a ton of time, but everyone's linked into multiple like coalitions through BAG, as well as like, for example, so Fran Jimenez also serves on the child protection team as well as adult protection team. So it's really linked in pretty tightly. Fran also goes into the high school as well as well, Fran didn't, but Jane did, but Fran will carry that on. Like we go in and do sex ed, you know, to the high school as well as, you know, the intermediate school. And so, and then like, I think of like, and then, you know, so I think my bigger point is like, everyone's kind of got, as you like, multiple hats, and they are reaching out, but if there's better connections and what that looks like, I think what you're asking, Sarah, and maybe there's a part of like, you know, mapping that all out to say, actually, this person crosses with this agency, and, you know, and Fran also sits on the DVT, you know, goes in and represents public health and is part of that piece as well. And, you know, like, and I yeah, so I feel like there's like a lot of overlap. And so like with the Child Coalition or like with Retail Food, that person's also sitting on food access. Our EH admin is, on the housing one. And I usually do the childcare, which I haven't been able to do, but I'm hoping to pick that back up. And so there is a lot of that kind of happening. But I think to your point, like figuring out what connections are we missing in the scheme of it all.
Well, and like that's awesome and great that they're participating on those coalitions, but how is that observation of what the community, what feedback they're getting from the community and those kind of conversations actually relaying back to then like DHS partners, or like, are we actually connecting the link of what we might be learning or hearing from the community to the resources available? And then are we promoting those in those meetings, or are we just attending and listening? And because I don't know.
No, yeah, no, I hear you. I think
I
think
would
that's
love-
I think
I
that
would love
happens
for the
organic.
board to be
Oh, I'm
able
sorry.
to,
Go ahead.
I would love for the board to be able to maybe like, hear from our staff from participating in those, and maybe we do through Tim or something, and maybe that just isn't like a collective like report back to us, so I'm sorry if I've missed it. It would be great to like hear back from staff of who know the resources and know like the network of what that community like what they're hearing at those meetings. And because Jeff can report to COG, Ayla can do whatever's happening at the opioid if appropriate, and Jeff can also, we can all communicate with probation, or like just like help connect the dots.
Well, I think, and I don't know, you can, I think, before we move too far into planning to increase positions, programs, and oversights, we should try to fine tune a little bit more what we have.
Yeah, that's just that, like this is pie in the sky. This is like 5 years out. Like this isn't, I'm gonna get all this done and I want all this to happen in a year. I'm just putting it on the table as, hey, I think these are some gaps kind of a thing, just from some of the information, and trying just to figure out, kind of your point, Sarah, like who owns it? Like I said, I don't have to own health navigation. I don't have to, is the hospital serve diabetes and heart healthy? Great, like let them own it. Like I just think of like, it's that ownership piece. And I think what will be helpful for me is to kind of map out where everyone kind of crisscrosses, because there really is so much that does happen organically behind the scene. I feel like we've gotten much better. Gloria Perez likes to call it hot potato. I think we've gotten so much better at not hot potatoing people, being like, I don't know, go to them. I don't know, go to them. And when that does happen to someone, we're very quickly like making that phone call to be like, hey, you sent them here, but remember, we don't do that. These people do it. And here's all that information. So it's not just a one-off. It's always like an opportunity to, remake that connection. And especially as there's been transition and turnover. But I think to your point, like I can map that all out so you can kind of see that like web and network, so to speak. And everyone does get a lot of that general information as well, and go from there. But I can totally appreciate like what you were just saying, Kayla, like I want some stability. I just want to build. I just want to make sure that everyone's confident and comfortable in their programming pieces to then expand into some of some of those other pieces that you guys would recommend, so to speak.
Yeah, go ahead.
I think that's like, I'm not a failure of public health. I think it's just a failure of turnover, and like just our, as we like continue to be surprised at how, I mean, wearing so many hats, but yet like not necessarily making the right connections in many different areas.
Yeah, and I think it's always helpful if there's like a specific example that's like such a great lesson learned. Like, hey, this is exactly what I heard, and this is where we feel that there was a fail in the system. And I'll be like, great, let's figure out that fail and make sure that doesn't happen. Again, it's kind of hard when it's more general than it's specific. So like if you use something specific, it's like great. And because like, and I've had this conversation with you guys, like a lot of time, and we know this happens, and not just us and the work that you do and what you say or what's interpreted. Like I would always appreciate that, that initial, like when someone has like, hey, I didn't get this because this happened, instead of being like, oh, that, like always, like we want to
Sure.
validate them, but I don't necessarily want it to be like, oh yeah, I'm sorry that public health failed versus like, hey, you know what, I'm going to go reach out to public health and I'm going to find out. Because I think sometimes what happens is when we finally get the whole story, it's like, oh no, we have communicated, multiple times, but they just didn't hear and or they didn't like it. And so therefore, we're not getting quite the full picture. And so I think that's, you know what I mean? Like, so I think like the more that we can close those gaps as well, like, hey, this is an example. Can you let me know what you know about it? And not to say, and I feel like that's happened multiple times, right? And you guys have been really good about like, hey, this happened. I'm like, oh, actually, would you like to see the 4 emails and the 2 phone conversations I had with that person when they're like, public health never called me back.
Yeah.
And like, really?
And I don't have anything specific, Colleen. I'm not like reacting to any complaints or anything. I just.
I'm just saying for the future, like, because to your point of like, how are we gonna like tighten the gaps or know where there is, that blind spot that we're not aware of? Because you're sharing, the fact that like, hey, I don't know, the public health's like putting people where they need to be kind of a thing. So that's my point. If there's a specific example or like, hey, it's great you're attending, but really what are you doing? Like, is kind of where I'm at.
Right. Yeah, and I think for me, like specifically just have an interest in that senior coordination because I feel like there's just a lot of opportunity with some stronger relationship building on some needs for seniors. And with the veteran services and C4 and the house, helping with home assistance somehow, I just feel like there's a lot of opportunity there. And
absolutely. No, I fully agree. And I think I think that that's a bigger conversation, like in a work session and bringing people together, not just like, I want you to be aware of this versus, hey, this is a really great connection. And maybe that then gets punted to us in a positive way of like, hey, I want you to meet with C4, these folks, like, through Tim, right? Being like, hey, this is where we think that connection is missing. Get these folks together and, and we can then report back, to the Board of Health to say, hey, we did come together. We smoothed out whatever that process is, and or we can add this because we have a better understanding. So,
Colleen, my only question really with how it sits currently is there any kind of short-term goal, I guess, if you will, to kind of look at the operational structure of environmental health and make any changes, or is the plan to maintain those positions and just maintain what we're doing? Or are there active conversations of, looking at a contractor to redo the regulations, look at the title transfer program, the communication with building and land use that is now community development and how public health folds into community development. So just question around what that short term looks like.
Yeah, absolutely. And so I'm going to bring up. Well, I won't. No, I won't. I'm trying to like work it off my other screen. It's like my other screen is going crazy now. It's mimicking instead of being separate. But that is part. So the next thing that is on the agenda is the environmental health piece. And so I think what's really hard is maintain is not a word right now, only because I have 3 people who've worked less than a year in environmental health. So I don't know if it's a maintain versus like still learning. So like, for example, David's been here for not even 2 months yet. And he's taken on, on-site wastewater treatment systems, OWTS. And so, my short-term goal is to get those guys trained in and comfortable in what they're doing. We are utilizing Summit County for their technical assistance as well as the state. So if David comes across a permit now that seems a little bit complicated or he's a question on, we do have that support from both the state, from Chuck Cousineau, as well as Summit County. And he's also going over there and shadowing inspections in septic systems. Just so we haven't gone out on site for inspections in 2 years because of COVID, but we do have it in our regs that the engineer can provide those inspections. There is a form, and we're still rolling that way as David comes on board. And then for the transfer of title, so much of that is coming through the environmental admin person is truly doing a lot of that work and educating. We just put out a homeowner's guide. We just put out something to all of the realtors and all the folks that might be involved in anything that might be there to say, hey, we need to do Zoom or a meeting so we can answer any questions and help decrease some of the confusion in the process, because I recognize that that's hard and challenging. And I think people don't always recognize too that it's a timeline. You can't call us or submit a TOT today to close on a house tomorrow. Like that just isn't feasible. And so trying to make sure that we're gaming it as far out as possible so that realtors do understand that, hey, as soon as the sale's coming up, things you should be thinking about, or a seller, is looking, they should be doing that right away. And then retail food and childcare, that still is, that's Kelsey. She's been here for about 6 months and is really kind of building back that program and is going out on inspections. We're having really positive feedback from, restaurant owners, and truly in that collaboration nature of, and her also, being very honest, like, hey, I'm learning right alongside with you. It says that we need to be doing this. It doesn't appear that way. So let's figure out a way that, we make sure that you're in compliance. I understand what the needs are, et cetera. And so my short term is truly to stabilize those guys. They have asked, and that's one of my questions today is, we do have, with the funding that you guys have provided from the county, to say, yes, we want those 3 positions plus, it was called an environmental director, but I would look to move to like a coordinator and or a manager who is a regional environmental health specialist who either has both retail food and OWTS as well, and either or, just to have that support in-house for folks in order to have their program and then have the ability to kind of cross-train. That's what we see happens in other counties as well, is that they have someone kind of managing those pieces, and then the other specialists are all cross-trained in their programs. And I think that's really a great way to kind of, so I would be looking to, I am on my way out for 2 weeks, but when I come back to say, hey, can we look at some job descriptions to bring that in? I think, that management piece is, I cannot be everything to everybody. And I have a lot of new staff. Like when I talked to you guys last time and we had our, our work session, not as a Board of Health, was like, hey, I've lost, 5 staff. Well, now I've lost, 6 staff. And now I'm like, so almost everyone, like I have more new staff than I have, old staff at this point in time, so to speak, like anyone who's worked here for 4 or more years. And so that's just, as you guys know, a lot of time and energy getting people onboarded and ready to go. So for short time, I would say stabilize environmental health. We are working really closely, as we always have with Anne, in that we don't have to redo our regs until 2023. I think we have to start. And I don't know if that's a contracted position or, basically it's a pretty simple process. And actually we don't have to do it in 2023 because the state was supposed to do it and they haven't. So until they look to re-up them, I think it's now 2024 that they push that out. Then we just have to make sure that we're in compliance with whatever they might have added that's new, as well as having some opportunity locally to put in some things that make sense as well. And we do have the ability to amend those without doing a full blown assessment. It's more of stakeholders bringing folks together and getting that input from stakeholders community to say, hey, we think this is an important change we want to make, and just doing that. So that's kind of where I'm at with EH.
Okay. I don't know. Oh, go ahead. Go ahead. Do you have a question?
I do.
Go ahead.
Okay. I would love to continue, or to encourage you to continue to have Kelsey's approach be a solution-based one, and that sounds great. And so as much as we as the Board of Health can
I think it's been a
that
positive
way.
shift. Like
that's the best. Yeah, that I think that's our most responsive.
I agree. And, and I think, we recognize some of our problems in the past. And I feel like some of that might have been, transitioned out. And now we have that ability to really build that from the beginning. And even, the conversations that I am having, with some of my newer staff is, in the end, we're just trying to get people where we need them to be and do our best. They're not going to understand all the nuancy pieces. So the more concise we can be, the more we can support them, because everything that we do, especially when it comes to regulation, we're encroaching on people's livelihood. It was the same thing that happened in COVID. Everything that we're talking about. So when you're going into like a restaurant, like that is their livelihood. And we want to make sure that, we're getting to where they need to be and have appropriate timelines and, and solutions, so to speak. So thank you for that. I can appreciate that.
Yeah.
Yeah.
And the other thing on the title transfer work, and I would encourage, I think, because it's so complicated, it would be great on the second time around, having gone through that in 2018, to have the state here. I know Chuck's offered to do some of that. And so maybe we do, and as we've talked about other boards and things, just getting people up to speed or on board, or reminding folks of like, having a 101 on all of those things might be great. And then specifically, I would kind of request that maybe we look at that title transfer, because I think we want to look at, we've heard some of the concerns or complications, and specifically as it relates to housing and building and development. I want to make sure that we know what that program really entails, and that it's not inadvertently causing a lot of challenges that weren't necessarily foreseen in 2018. And in 2018, the whole update was passed, but public health hadn't yet actually outlined that program. And the conversation in that meeting with Board of Health in 2018 was that we approved it, and then public health was going to develop it. And I don't think the Board of Health ever saw that back. So
Okay.
I would request that maybe next time we meet, or we meet soon, to go over what that title transfer program actually looks like. And and maybe with land use, it might be good, or community planning and development.
I know, I have to go, like, I have to keep doing it in my head. I was like, I gotta remember, No, I think that's great. And like I said, we did have, just this week, David put out an email to all of our stakeholders to walk through that process and actually hold a meeting as an informational meeting. So we'll make sure that when that meeting gets set, that we invite in so we can hear all of those concerns and then kind of move from there.
Cool.
Yeah, absolutely. Like I said, everything, there's nothing in stone. Everything's room for improvement and trying to figure it out. I think the eye-opening part is truly how many systems have not been touched in ever. When it comes to like a sale, and people, haven't pumped in years, or haven't done this, or haven't recognized that, like, even utilizing a failed system for quite a long time. So, which, obviously then corrupts other pieces in the environmental world. So, okay, great. So the next thing I just have is that you have received that medical officer for that, just the sign off to say that, yes, Lisa signed it, and I just need a Board of Health person to sign that. I know that Claire has shared that with you. And so whenever you sign that and get that back, that would be great, so that we can just put it in our files for family planning specific. Like, you guys already did everything, totally really in January. We just need this one document to put in the family planning file, so to speak. Okay.
I can take care of that for you today. And I am sorry, Colleen, that kind of took a little longer. I think we touched some things on the agenda. But Commissioner Feeler has a meeting scheduled with probation and the DA in
Like 2 minutes ago.
50 seconds.
Yeah, no worries. All I would say, so the fourth thing is the Board of County Commissioner training. You guys are obligated to do that. I know that some of you are registered but haven't taken it, and some of you registered and take it. It just is like a hoop that we gotta go through. And I would be totally love to hear kind of what you learn and be like, oh my gosh, because sometimes what happens, right? I don't have fresh eyes at this point, as you can imagine. So I'd love to hear what you guys get out of it and be like, oh my gosh, we haven't thought about X. And I'd be like, oh my gosh, that's awesome. So, and then as far as the next Board of Health meeting, I'll just have Claire work with him and organize that up. It is quarterly. We don't have any, knock on wood, any variances coming up that we see. So we don't have to adjourn you guys for that, or bring you guys together for that. So maybe it's, so right, we're in July, August, September, October. So do we want one sooner or later? We'll just have Claire work with you guys, if that makes sense.
Okay.
Yeah, I think it'd be really good and really helpful if we could have a meeting, like Sarah was saying, and scheduled to see if the state can come up and walk us through kind of the current set of regulations, what we're looking at, what we're working with, and then for updating. So
yeah, absolutely. And then I would just say that whenever that next meeting is, I don't want to bring the state up if we haven't already, taken some training so that, because I want you to be able to like hit them with all the questions you have. You're like, I saw this, that doesn't make sense to me, or whatever, so that we can all benefit.
Okay.
Cool. Thank you.
Yeah, let's try to set a goal for our training to be complete by like July 15th, maybe.
And that would be fantastic.
If
I started mine.
possible. You did? Yeah.
Nice, good job. Awesome sauce. Thank you guys. So appreciate it.
We'll keep Tim and Claire apprised of our progress on our training and go from there.
Thank you. I appreciate it. Have a good rest of your day, guys.
All right. Thanks, Colleen.